Dr. Lepook, it seems like more and more people are talking about gluten-free diets and they're so popular in the media, but aren't gluten-free diets prescribed for people that actually have a disease?
Yes, celiac disease, which is an autoimmune reaction where you're very sensitive to a protein component of wheat called gluten. Now, in the 70s when I went to medical school, we thought people had to be really, really sick, have diarrhea, abdominal pain, weight loss, and now it turns out that you can have very subtle symptoms. You can have diarrhea, you can have constipation, you can have bloating, and there can be other things like fatigue, brain fog, infertility, short stature, migraine, all sorts of things that we never realized were associated with it. And the treatment for it is avoiding gluten. Gluten is in a lot of things, unfortunately. It's in wheat, it's in rye, it's in barley. Supposedly it's not in oats, but sometimes when the oats are prepared, they get contaminated by wheat, so sometimes you have to avoid that. And even things like French fries, which shouldn't have it, if they're fried up in oil that before that had, say, breading from chicken, then you can get cross-contamination. It's in soy sauce. So people who have true celiac disease really have to be careful.
How do I know if I have celiac disease? Can I go to a doctor like yourself to get diagnosed?
Absolutely, because a lot of the symptoms overlap with other things like irritable bowel and small intestinal bacterial overgrowth, lactose intolerance. So there are actually tests. There's a simple blood test which can be used to screen, and then if that's positive, you can do what's called an upper endoscopy. That's where you take a flexible tube and you slip it down the esophagus, which is the swallowing tube, into the stomach, and then into the first part of the small intestine, which is called the duodenum, and then you take some biopsies. And normally there are these absorptive fingers, they're called the villi, which absorb food, and with celiac you have a blunting of those, and you see a flattening, and you see some inflammatory cells that are typical.
Now, I understand that there are people besides those that have celiac disease that need to be on these kinds of diets.
People have recognized increasingly that there's something called non-celiac gluten sensitivity. Okay. And this is something which, at first we had too few people aware, and now I think that it's sort of gone all the way the other way, and there are so many people who think that they have this and they're just going off gluten and saying, I feel better. Now, unfortunately, right now it's very ill-defined. We don't know how many people have this, okay? We know that about 1 in 100 have true celiac, but the percentage of people who truly have non-celiac gluten sensitivity, they just don't feel well after they have the gluten, but they don't have, say, the abnormal blood tests or the abnormal biopsies. The problem is that there's a lot of overlap with other entities, irritable bowel, small bowel intestinal overgrowth, lactose intolerance, so it's hard to figure out who has what. So for people who feel better when they avoid gluten, well, that's fine, maybe that's what it was, but I would urge people to go to a doctor and try to really figure out what's going on.
Now, what about all these health claims out there that a gluten-free diet could help you lose weight or just make you feel better in general, regardless of if you have either of these conditions?
Right. Well, look, if any, doctors should never be cocky. If you feel better off the gluten, fine, avoid the gluten.
It's okay.
But you should know that it's not something that's going to make you, in and of itself, lose weight. I mean, foods that are gluten-free can have fat, they can have sugar. The flour is not necessarily fortified as normal flour is, so you may actually not be getting enough vitamins from there.
How do I know if a gluten-free diet is right for me?
Well, I think that if you're feeling badly after having things with gluten, I think you should talk to your doctor, because right now there are so many different things that could be contributing to this. You want to know really what your diagnosis is. You don't want to go through your whole life, for example, having celiac and not having adequately treated it, because to go on a true gluten-free diet is tough. So you don't want to just sort of avoid it, you want to avoid it. There are people who get to be 40, 50, 60 and suddenly they'll break a bone. They'll find out that they have osteoporosis, which is thinning of the bones, and when they're evaluated, it turns out all these years they had celiac. They weren't absorbing vitamin D and calcium enough. So I would urge people, if you're not feeling well, go to your doctor and try to figure out what's going on.